Welcome students. This is the continuation for the exit exam. It's nearing in October, and so I have taken some few questions from pharmacology. Some of the questions I have just asked 2-3 questions in shorts, and to make the students to answer in the comment box. So that answers can be explained today in this few questions in pharmacology, subject of our exit exam D Pharmacy students. Kindly subscribe my channel Pick Pharma DXP at DX Prasad, and you can see today's question which we have taken is the first one is very simple question. What is the function of intestine? That everybody knows. They have given a choice of 4 choice: digestion and absorption, excretion, respiration, filtration. Respiration by lungs, excretion by even kidney and urethra and genital organs, and filtration by kidney. So the selection is very easy, the questions. And now the second question for today is, what category of the muscle the ileum of guinea pig belongs? This guinea pig question about the ileum of guinea pig I have asked openly to the students to answer. The choice given is it the ileum of guinea pig is voluntary muscle or involuntary muscle, cardiac muscle, or none of the above? So we should be very clear about the ileum of the guinea pig. Is actually it comes in the intestine, or it is in ileum of the GIT area. So you can see the muscles, about the difference between the voluntary and involuntary muscles. Very clearly is by the picture it is shown. The muscles which are even smooth muscles may be present in this near to the skeletal muscle also. So you can see the voluntary muscles which are voluntarily which can be applied by you when you are walking, when you are running, when you are doing some work, like skeletal muscle which is shown in the arms and in the thigh, and you can see in various parts, even a lower abdomen muscle also. But if you see the involuntary muscles like cardiac muscles and the muscles in the intestine, and which we are talking about the even for ileum, and lungs muscles which are you can see, and the kidney muscles, the kidney tissues, these all are, you can see the muscles which are present, they are involuntary muscles. So the question answer is involuntary muscle. And which animal intestine is used to observe the effect of spasmogens? Spasmogens means spasm. They have given animal choice of rabbit, rat, mouse, and frog. Experiment animal. But rabbit, the effect of spasmogen and spasmolytic on rabbit jejunum, the jejunum which is present, the joining in this near to the small intestine and the large intestine, you can see jejunum, which have to be isolated, and it can be used for testing this spasmogen. And spasmogenic activity may follow the involvement of histaminergic and cholinergic receptor. However, spasmolytic activity may also the inhibition of voltage gate calcium channel. So this can be experimental animal which you have to use is rabbit jejunum by isolating can be observed. Which type of receptor are present in rabbit intestine? This is also a question. I gave an option in shorts. So they have given a choice of muscarinic receptor, nicotinic receptor, beta 1 receptor and beta 2 receptor. So when you think about intestine, we know that in intestines we have M1, M2 receptors are present. So we should not think about that answer is correct. There are researches been done by means of seeing various activity even about the salbutamol action towards in the intestine, isolated intestine of the rabbit. It has shown the activity of salbutamol which is acting on beta 2 receptor. So salbutamol exerts a much greater effect on the large intestine than in the small intestine, indicates that beta receptor of a large intestine are mainly of beta 2 type. In rabbit it is present. So in rabbit they have identified the beta 2 receptors are present in the intestine. So that is the answer. Exact answer should be selected if there is a fourth choice which is given. So which type of effect is produced by xylocaine? So here xylocaine we know very well it is a local anesthetic. So local anesthesia it is effect because the choice is given like local anesthesia, general anesthesia, relaxation of heart and stimulation of heart. But we should understand some of more points can be explained by me, which the knowledge sharing. You can see xylocaine can also be called as the lidocaine. So these two are interchangeable, the names, also known as lignocaine. So the different names, same medicine, which are used to stop the pain during the dental procedures. And it can be used as a regional anesthetic also, local anesthetic. And you can see this is the product which is available in the market, that is lignocaine hydrochloride injection, which you can mention that xylocaine 2% in 30 ml vial it is available. So we can see local anesthetic lidocaine stabilizes the neuronal membrane by inhibiting the ionic flux required for the initiation and condition of impulses, thereby affecting local anesthetic action. And also students have to have an idea why in some cases we are mixing up with adrenaline. So adrenaline, you know that adrenergic drug, and adrenaline is mixed up, and there is a dose which is used usually for regional anesthesia where construction of blood vessels can take place in the area, and it can be used as a local anesthetic for even for dental procedures and also for minor surgeries in particular area can be done. And this can be sustained, the action of the local anesthetics whichever you are using, the local, that is cane variety, that is lidocaine, lignocaine, all these things are bevocaine, the long acting can be, when you are using it, if you are mixed with adrenaline, then it is possible for the regional anesthesia can be sustained and it can live. But if the patient is already having a history of cardiac patient, then you should avoid mixing up with adrenaline. So this type of contraindications and applications are needed to know for this type of multiple choice exams for the government examination which is framed. So some of the knowledge if you have, you can write very clearly without any doubt or suspicious in the choice of the answer which is given. The next one is in toxicology. They have given very clearly the choice. Toxicology means we have seen toxicity, minimum effective concentration, and the dose which is increased the level of the blood glucose stream, then automatically above the effective concentration or minimum effective concentration, maximum effective concentration above which it is called toxicity. But even the poisons effect as a study, and the effect of the drug in the study, effect of additive studies, effect of excipient study, no, it is about the poisons or the overdosage about the study which is called toxicity. This is the scientist which you have to remember about Paracelsus. He is the founder of, he was in before the Christ, he told in to 450 itself. But only in the 16th century we started accepting his words. Dose makes the medicine, whether it is a drug or a poison or a food. He only made that when it is increased, even oxygen, if it is increased, it will become a toxicity. And if water, if it is increased also, it becomes toxicity. It is given by Paracelsus. And you can see the increase in size of pupil. Size of pupil, that we can see increasing the size of the pupil, that is mydriasis. Actually small in size, meiosis, like that you can remember, meiosis, mydriasis. So this is increasing the size of the pupil, that small aperture or the hole which is present in the eye means it is mydriasis. They have given a choice as meiosis, contraction of the eye, relaxation of the eye. No, when the size of the pupil is minimized, then it is called mydriasis. Mydriasis, meiosis. You can see the pupil, the small, which is how the mydriasis, the dark round which is shown by, which is we can see, but the whole have been dilated. And here you can see the pinpoint very clearly. You can see in meiosis it is constricted. So this is the point which you should remember. What is the effect of strychnine sulfate on spinal cord? Strychnine is present in Nexomica. It is a poison and also it has stimulant effect. And they have asked whether it is stimulation in the spinal cord or depression, contraction, relaxation. Even though we know it causes convulsion, it is a poisonous drug, strychnine, brucin. They are present in but strychnine is a potent convulsant. It causes convulsion. It causes convulsion by means of its potent stimulate effect. And what is the stimulation? Why it is stimulation is the correct answer. It increases the reflex excitability in the spinal cord, and that results in the loss of normal inhibition of spread of motor cell stimulation, so that all muscle contracts simultaneously. So strychnine causes excitation in all parts of the CNS. That is why it stimulates and causes the convulsions. So you can see next question is diazepam is a benzodiazepine. Diazepam is whether it is a choice they are given hypnotic drug, sedative drug or anticonvulsant drug, all the above. A diazepam can be used as a hypnotic drug, it can be used as a sedative drug, it can be used in an anticonvulsant drug. This diazepam, that benzodiazepine, there are many varieties, but diazepam is the simplest form of the initial drug. So it can be used in all the way in the initial stage. So diazepam is used primarily in the treatment of mental anxiety. In the addition, it acts as a muscle relaxant. It acts as a muscle relaxant or a variety of medical conditions. It may also used for sedative, hypnotic and anticonvulsant. And you can see this is the tablets which are available 2 milligram, 5 milligram, 10 milligram. Also according to the physician's diagnosis, it can be prescribed. And that is diazepam tablets that treats seizures, that initial stage of convulsion, muscle spasm and twitches, and it may also be used to treat anxiety, including before the procedure. It can also be used to reduce the symptoms of alcohol withdrawal. It works by helping your nervous system calm down. And you can see the next question, mephentamine. Mephentamine is used as the choice they are given cardiac stimulant, anti-amoebic and anti-ulcer drug, or it is vasodilator. But it is a cardiac stimulant, very important. That is, what is the drug? You can see mephentamine sulfate injection is a cardiac stimulant that is especially primarily used as a normalize decrease blood pressure, hypotension that may arise from administration of anesthesia for a patient in the spinal cord procedure. If they are doing the surgery, they may cause this hypotension issue, and it is employed to elevate the blood pressure in case of, that means in cases like which is given by spinal cord anesthesia, that hypotensive can be treated and low pressure states can be treated by means of mephentamine, which is regulate the blood pressure which stimulate the cardiac stimulation is given by this drug. So it's an important drug to be remembered. You should remember about methentamine. They may ask, that is methentamine, you should remember. And next you can see water is also called as, or water is called as a diuretic. How? Whether it is a loop diuretic or thiazide diuretic or high ceiling diuretic, that is all wrong answer. Only thing is, it is a physiologically, if you drink more water, stimulates the excretion and also reabsorption. You can see that increase the flow. The term water diuresis refers to increase the urine flow caused by decreasing the reabsorption of solute free water in the collecting duct, of the kidney function of nephron. You may be knowing the parts in the collecting duct. You can see increasing the urine flow by causing the decreasing the reabsorption in the collecting duct during the water diuresis. Urine osmoticity is less than the plasma osmoticity. And you can see what is the dose of hydrochlorothiazide by oral route. Hydrochlorothiazide is a diuretic actually. Hydrochlorothiazide, what is its dose? Actually they are given 25 to 100 milligram per day, 30 to 50 milligram per day, 100 to 150 milligram per day, 150 to 250 milligram per day. The correct choice and answer is 25 to 100 milligram per day. And you can see the normally the drugs which is available in the market, hydrochlorothiazide IP in 12.5 milligram tablets are available. Every day a person can take 25 milligram means BD, 100 mil if he is more, if he needs maximum of 4 times a day. But usually these drugs are given in the daytime. You can see hydrochlorothiazide is used in the treatment of edema, fluid retention and excess fluid held in the body tissues caused by the various medical conditions, problems including heart problem, kidney and liver diseases, and to treat the edema caused by using certain medication including estrogen and corticosteroids. So you should have some information I have given, listen, and so that you can be remember what is hydrochlorothiazide and how it can be, what is the, why the dose is 25 to 100 milligram, what is the market which is available. These all things can be remembered. What is the dose of prednisolone for adults? What is the dose of prednisolone for adult? So you should know some of more points about prednisolone also, but the dose exactly is 10 to 60 milligram per day is the correct answer. They are given a choice of 1 to 30 milligram per day, 30 to 80 milligram per day, 50 to 100 milligram per day. But why it is, that is the dose of prednisolone you will take depends on your health problem. And what is prednisolone use? Whether you are taking it in a short course or a long course or a longer period, they usually by diagnosis, the usual dose varies between 5 milligram to 60 milligram. 5 milligram to 60 milligram. They have given a choice of 10 to 60 milligram, which is coming in the ratio which is about, theoretically it is 5 milligram to 60 milligram daily, but occasionally higher doses may be prescribed in some cases. The strength of tablet range from 1 milligram to 25 milligram. You can see that this prednisolone tablet which is available is 2.5 milligram, which is available tablets USP. So 2.5 milligram, if a person is 10 milligram means they may give 4 times a day, or you can see 3 times a day can be given in initial stage. The dose can be increased per day up to 60 milligram. Prednisolone is a man-made form of a natural substance, corticosteroid hormone, made by the adrenal gland. It is used to treat conditions such as arthritis, blood problems, immune system disorders, skin and eye condition, breathing problem, cancer, and serves allergies also. So it has a variety of treatment the steroid can be used. But you can see the next question, streptomycin is used for the treatment of We know that it is an macrolytic antibiotic, which is very strong antibiotic, which has been come after the penicillin, which was used for treatment of tuberculosis, which is the whole world threat of tuberculosis. What treated with streptomycin is a choice of macrolytic, that is broad spectrum antibiotic. They have given a choice: tuberculosis, heart disease, eye infection, kidney disease. Very clearly we know that we can select that streptomycin is the choice of drug for tuberculosis. Streptomycin is it is called that is pronunciation streptomycin is an aminoglycoside antibiotic. It is used to treat certain it is aminoglycoside, that is macrolytic amino acids can be erythrocyte, but you cannot say it is an aminoglycoside antibiotic. It is used to treat certain kinds of bacterial infection. It will not work for colds and flu or other viral infection. So streptomycin specifically we can remember it's for anti-tuberculosis antibiotic. So you can see next one is amoebiasis. The infection occurs in which part of the body? That is a question which I asked even in the shorts. You can find the answer from here. Especially the answer is intestine and liver. We will be knowing about it is amoebic dysentery, which is only intestine or only liver, only kidney. No, it is affecting liver and as well as intestine in the initial stage infection. Amoebiasis is an infection of the intestine. It causes by the microscopic parasite which is called Endamoeba histolytica. That means the Endamoeba histolytica most commonly causes intestinal amoebiasis, but can also affect the liver, respiratory tract, heart and brain. Liver and liver, it is mainly amoebiasis or amoebic dysentery. Abscess formation is most common intracellular complications, which we have, the picture have been shown in the shots also. The next one is Ravibirin. Ravibirin is an antiviral HIV drug. Antiviral drug. They asked Ravibirin what type of drug, whether it is an antiviral drug or anticoagulant drug or antacid or anti-amoebic drug. The answer exactly it is an antiviral drug which is more prescribed for HIV tablet actually. The Ravibirin is an antiviral medication that works with the other medication to treat hepatitis C also, and it can be used for even HIV also, hepatitis C. And this condition is the virus that causes chronic liver inflammation, and this medication comes in a tablet form that you can take by mouth with a glass of water. Usually this is particularly for hepatitis C. Sometimes it is antiviral, that means Rabivarin, acyclovir. These all can be even given for the antiviral drug, but especially it is for hepatitis C, very dangerous virus and very dangerous disease which can cause for death immediately. And which is the following is obtained from vinca. Vinca rosaceae is the plant which is for anti-cancer constituent which have vincrestin, vinblastin, vendolin. These all are present in the very constituent. So vincrestin is the main constituent. They are given a choice of vincrestin, neomycin, azithromycin and streptomycin, but vincrestin is the right answer, which is the vinca rosaceae plant, and the constituent which is present is very low constituent. If you give 1 ton, you will get 3 grams of vincrestin, vinblastin constituents can be isolated. And next question, the maintenance dose of thiopental sodium is dash milligram per kg per hour. So you can see that milligram per kilogram of the body weight hour, they are given how much the maintenance dose. That is the point which you should remember. Maintenance dose means what? So it's giving an anesthesia. It's a short-acting, ultra-short-acting barbiturate is thiopental sodium, which is used for a balanced, especially it is used for balanced anesthesia, general anesthesia. So in that case, the answer is 3 to 5 milligram, but the given choice for above 7, above 6 to 7 and 1 to 3 is low, but 3 to 5 is the main. When you are using for inducing a balanced anesthesia, this thiopental sodium is an ultra short acting barbiturate which balanced anesthesia with a skeletal muscle relaxant, and it has inhalation agent. As an initial dose it is given 210 to 280 milligram, and afterwards 3 to 4 milligram per kg. According to that, it is usually required to rapid induction in the average adult of 70 kg. And you can see the next question is levodopa always given in the combination with. Already we have seen this question in another subject also, where we know that carbidopa and levodopa are joined together. Levodopa is one of the thing which is giving the function of which will convert into dopamine, and which is restricted for the various diseases, especially for Parkinsonism disease. But why we want to combine with carbidopa, which can prevent this levodopa not getting converted or not getting degraded in the before entering into the or before crossing the blood-brain barrier. So carbidopa is the choice which can be combined with levodopa. So you can see this choice, the ratio also last time we have seen in 10:1 the combination have been made, and carbidopa and benzotropine they are given a choice, it is not the right, and benzotropine is not the choice of combining with them, and orphanardine is also not the correct answer. And you can see the next question is actually pymoside acts by blocking what receptor? It can block the D2 receptor. D2 receptor, that is pymoside. What is pymoside? Pymoside is an diphenyl butyl piperidine derivative that differs in structurally from the phenothiazine, the three-membered ring structure of phenothiazine, that appears to act by blocking dopamine type 2 D2 receptor. Pymoxide has other central and peripheral effect, including anticholinergic and alpha-adrenergic blockage. So this is the thing which you should remember. Which drug is called as Largactil or Largactil? What is that Largactil? Largactil is a trade name which contains actually chlorpromazine. Chlorpromazine is a drug which is having a similar structure of promethazine, only a substituent change. But chlormethazine is usually it is for an antipsychotic drug also. It can be marketed in the form of two drugs, that is Largactil or Largactil and Toracin. So Toracin and Largactil, they both are trade name, which is chlorpromazine marketed under the brand name of Toracin and also Largactil. So among others, it is an antipsychotic medicine, and it is primarily used for the treatment of psychotic disorders such as schizophrenia, and also you can see it is more common for using sometimes by insomnia also. And also you can see which drug is contraindicated in the breastfeeding in mother. Tetracycline. You can see when you are using tetracycline, even the infant born may be having the baby teeth can be, that is the color can be changed due to the chelation of the calcium, which may be made into uncolored teeth can be formed. And also you can see in this choice they are given about the domiprodone, paracetamol everybody knows, senna you know that is laxative. And what is the use of this domiprodone? Domiprodone also they have added, it is also blocks the dopamine receptor in the gut and a part of the brain link, and also it starts the link to vomiting sector, that means CTZ, that means chemoreceptor trigger zone, which is located outside the blood-brain barrier. This results in increasing the esophageal gastric peristalsis, which can food moves quickly through the stomach and into the intestine, by which you can control the vomiting. This was actually used for controlling the vomiting while motion sickness, traveling sickness. These all can be domperidone can be used. But there was what is the drug which is you can select for contraindicated for breastfeeding means tetracycline. But the choice of domperidone, when it is added, I just added some details because if they ask some different question, it is possible for the students to answer. And insulin is a what type of substance it is? It is naturally produced, secreted by islets of Langerhans in our body. It is a polypeptide hormone. It is not a neurotransmitter. It is not an adrenogen. It is not a receptor. It is very clear. Everybody knows that it is insulin. Even we are manufacturing by means of taking some tissue culture or biotechnology procedure can also be produced, because it is polypeptide hormone which is secreted by islets of Langerhans. This is the answer which you should remember. Anyhow, I have taken a very small class for pharmacology, and again next class, next few days we will come for the next other subject also, some few questions, and try to answer and try to listen and read more and interpret and find whether the answer is correct or not. That is the main thing which you should make, and so that you can remember which is exactly correct. Number of reviews have stated the about the tetracycline, the contraindicated due to breastfeeding because the possible staining in the infants, dental enamel and the bone deposition of tetracycline, that I told with you previously about the first in the 39th question. Thank you for listening.